In this video, I'll be talking you through radiotherapy, including what it is and what you might expect if you are having radiotherapy as part of your treatment. What is radiotherapy and what is it used for? Radiotherapy is a type of treatment used to treat cancer. Most radiotherapy treatments use X-rays, the same type used in an X-ray of a chest or a broken bone. With radiotherapy, the X-rays are much more powerful and have a higher energy. These X-rays are delivered to the tumour very precisely using a machine called the linear accelerator. Great care is taken to deliver these doses of powerful X-rays to the cancer without treating a large amount of normal healthy tissue that make up the organs in our bodies. When radiotherapy is used to treat lung cancer, it can be used by itself, but can also be used with chemotherapy or surgery. Radiotherapy treatment is given to patients in small doses over a number of days or weeks. This can range from a radiotherapy treatment delivered in one session, all the way up to treatments that last for 6.5 weeks. Your doctor will explain how radiotherapy is being used for you. Your doctor, known as a clinical oncologist, works alongside a whole team of highly trained radiographers, physicists and specialist nurses to design and deliver the best possible treatment for your lung cancer. You will also be seen by this team of specially trained therapeutic radiographers at each radiotherapy appointment. Your first appointment, the planning scan. If radiotherapy has been recommended as a treatment, you will be asked to attend the radiotherapy department for a radiotherapy planning scan appointment. During the radiotherapy planning appointment, a CT scan is obtained using X-rays and a computer to create detailed images of the inside of your body. These images are used in order to plan a treatment that is tailored specifically for you and your cancer and helps us to decide where exactly the radiotherapy treatment needs to be delivered. This planning scan is very similar to a CT scan. During this planning appointment, you will be asked to lie on your back on the CT couch with your arms above your head. The radiographers will assist in positioning you correctly and ensuring you remain still and comfortable for the procedure. It is important that you are in the same position for each treatment to ensure the most effective outcome. If the treatment area is high up in the chest area, a mould of your head and neck area may be needed to create a plastic mask, which will help you to remain still during your treatment. Please be assured that these masks won't make it difficult for you to breathe or swallow. You may be given a special dye called contrast during your radiotherapy planning scan. If this is needed, it is usually given through a cannula on the back of your hand. This can help the team plan your treatment with more accuracy. The radiotherapy planning scan appointment usually takes about 20 minutes, but can last up to an hour depending on your individual needs. The actual scan is very quick and painless. Radiotherapy planning. Expect a gap of 10 to 14 days between your radiotherapy planning scan and your first radiotherapy treatment. Our team will prepare a unique and individually tailored radiotherapy treatment plan specifically for you and your cancer to ensure your radiotherapy treatment is safe and of the highest possible quality. There are a range of radiotherapy treatment delivery techniques that can be used. The number of treatments you will have will depend upon the area that is being treated and the intended benefits expected from your radiotherapy. Your clinical team may have in mind a certain number of treatment sessions for you before they review your radiotherapy plan. After reviewing your radiotherapy planning scan, they may decide to either increase or decrease the number of treatment sessions you will have to ensure the treatment is safe and effective for you. This final radiotherapy technique and number of treatment sessions can only be determined after the treatment planning stage has been completed. Radiotherapy treatment. After the radiotherapy planning stage is completed, you will attend your first radiotherapy treatment session. The radiographers are there to administer your treatment and answer any questions you may have, and also to help you feel as comfortable and relaxed as possible. You will be assisted getting onto the bed and positioning yourself in the exact position you were in for the radiotherapy planning scan. You'll be asked to breathe normally and to remain as still as possible. During the session, the radiographers will carry out their checks and move the equipment around you until they are satisfied with the arrangement of the radiotherapy machine and your position on the treatment couch. The radiographers will leave the room prior to delivering your treatment, but will be in a nearby control room. You can communicate via the intercom system and will be monitored via cameras. If you require assistance, our radiographers will be there in seconds. During your radiotherapy session, the linear accelerator will move around you, stopping in certain positions and then moving again to the next position. During this time, the radiographers are reviewing the scan and may make a few more adjustments to your position. Once the final checks are complete, the radiographers will switch the machine on to deliver your radiotherapy. The treatment machines make a buzzing sound as they deliver the radiotherapy, but you won't feel anything and often won't even know the radiation has been given. This will only take a few minutes and does not hurt. An entire radiotherapy session takes around 15 minutes, although more complex treatments may last up to an hour. Once the radiotherapy machine is switched off, there is no radiation in the room. The team will come back into the room and help you prepare for leaving. Radiotherapy is available Monday to Friday. It is important that you attend all scheduled sessions, as skipping sessions could reduce the effectiveness of your treatment. Radiotherapy is usually given on an outpatient basis, except in specific cases where a hospital stay may be necessary. You will be reviewed by your team throughout the course of your radiotherapy treatment. This might be your clinical oncology consultant or their team, which includes other doctors, specialist radiographers and nurses. After your radiotherapy treatment. You are not radioactive after your treatment, and you can mix with friends and family as normal before and after radiotherapy treatment sessions. Radiotherapy will continue to work within your body after treatment sessions, and you may experience some side effects. Possible side effects may include tiredness, red and/or sore skin, discomfort on swallowing, an increase in shortness of breath or cough. Your team will discuss the side effects specific to you in your assessment consultation before you start radiotherapy. This means you will know what to expect during and after your treatment. You will be advised who to contact for help managing any side effects. What happens next? It can be very difficult to know how the radiotherapy is working when you are still undergoing treatment. Your clinical team will see you approximately 6 weeks after your last radiotherapy session. You will also be given contact numbers for your specialist nurse if you have any questions in the meantime. This appointment will review how you are managing with any side effects and to arrange a scan around 3 to 6 months after the completion of your radiotherapy. This information will help us to find out how you have responded to your radiotherapy treatment and can be discussed in detail in future appointments.